So things to look out for an unwell mum. It's really normal for you to feel really tired after birth, however you shouldn't feel unwell. And there are a few things that we will check with you to make sure that you are recovering well. So blood loss. We do expect quite a heavy blood loss initially, but this should decrease as the days and weeks go on. You may sometimes experience a little bit of heavier bleeding if you are breastfeeding or if you've been increasing your physical activity a little bit. However, in general terms, it should decrease over time. If you experience quite a large increase, it's really important that you seek help. If you have experienced any tears that required stitching after birth, we will offer to check your perineum both in the hospital and at home by a community midwife. So signs of an unhealthy perineum are offensive smell, pus coming from the wound, or if it becomes really red, inflamed, hot and really painful. If you are experiencing any nausea or vomiting or diarrhea after birth, this is not normal, and it's really important that you tell us so we can give you advice and any help that you may need. So you're not as mobile during pregnancy and your blood's often thick and sticky, so you are at an increased risk in really rare circumstances of a blood clot. Therefore, we will ask about your legs, how mobile you are, if you have any localized pain or swelling, and if you have, it's really important that we get you help as soon as possible. If you notice this occurring in between community visits, it's really very important that you contact Pregnancy Assessment Unit immediately. It's really important that you are open and honest with us about your mental health in the postnatal period. It's something that we will ask about regularly. Normally day 3, you get a large hormone surge, you'll feel tired, you'll feel overwhelmed, and it's completely normal at this point. You will have heard it referred to as the baby blues. However, 1 in 10 women suffer with postnatal depression. If a couple of weeks down the line you feel overwhelmed, anxious, depressed, it's really, really important that you seek help from your GP. Do not suffer in silence.